Interestingly, the drug has been tested in a number of other cancers besides myeloma, and in all the cancers has a uniform overall response rate of about 20%. So clearly there is something unique about 1/5 of the human population that makes them sensitive to the drug. And my lab has been actually working on finding out what distinguishes the patients that respond and don't respond for long periods of time. And we have an early signal that's very promising and going to be presented at ASH. So what we did was we looked at patients that were treated with selinexor on some of these early trials and divided the patients into two groups. There were patients that had more than 3 months of response, or patients that had less than 3 months of response. And by taking the tumor cells, extracting the RNA and sequencing it, we were able to actually find differences between patients that responded with a PFS more than 3 months and patients that didn't. And interestingly, the key difference was a protein actually that's very important in cell cycle. So the change that we found was E2F1. This is going to be presented more in detail in a couple of months, but I'll give you the highlight today. The E2F1 protein seems to be very important in resistance to selinexor. So if patients have a high level of E2F1, then they are less likely to respond, and this could be an important biomarker for picking patients that will have better outcomes with this drug.